evening and welcome to Epilepsy
Today!
Hey, here we are, Martha.
We're back again!
It feels like we never left.
Hey, you know what? We don't change clothes.
Hey, this is all I got. It's been a bad year so far. What the heck?
Didn't bring you any toys or clothes?
No.
You must have got a bunch of clothes. Were you bad?
Yeah.
Oh.
You had to ask?
Nobody likes me. Everybody.
That's the way it was. But we've got important stuff to talk about.
All right, well, let's get to it.
There's a new medication. Santa didn't bring any clothes, but he did bring a new medication.
He brought drugs! Good ones, good drugs, good drugs. We don't want to go around throwing our glasses anymore or anything. These are good drugs for seizures.
No. Stop it. That's really not very
See?
nice.
There it is. I'm keeping mine on. I'm going to have self-control.
Not very nice. Now, there's a new medication that's just recently been approved by the FDA.
Okay.
The Food and Drug Administration. That particular medication is known as Aptiom. A-P-T-I-O-M. Aptiom.
Aptiom.
You think that would be an N at the end.
Yeah.
But it's an M.
It's like curriculum. I always think curriculum should have it in, but you know, it doesn't.
I understand. But it's also known as, you're good with these big chemical names.
Oh boy.
Eslicarbazine.
Eslicarbazine. Come on, we can't be out here like this on these city streets telling everybody we can't pronounce this stuff.
Aptiom.
Aptiom. That's what we're going to go with.
Got it such a nice little simple name.
Yes, this is why, yeah.
Eslicarbazine.
Eslicarbazine.
Acetate. Okay,
Acetate.
Now, this particular medication is, it's approved for treatment of partial seizures, the most common type of seizure activity in people with epilepsy. And,
I didn't know that.
Yeah.
I didn't know that was the most, that partial epilepsy was
most common.
Really?
Yeah. Especially among adults.
Interesting.
Yeah, I think so.
Yeah, that really is.
Yeah.
Not even playing.
Well, you learn something.
Yay!
Stick with me, honey.
All right.
The most common side, this was shown to be very effective in reducing the frequency of seizure activity. It's used as an add-on. Okay, so you got your existing anti-epileptic medication. Okay, maybe it's not doing the greatest job in the world. You're still having some breakthrough seizures and stuff like that. So what they'll do is they'll take this particular drug, this Aptiom, and they'll add that on to your existing drugs and maybe get better seizure control. Okay, so that's what they do.
That's good.
So yeah, it's out there. It's brand new here in the United States. And they're finding that it's got all medications have side effects. Some of the common side effects reported in patients receiving Aptiom include dizziness, drowsiness, nausea, headache, double vision, vomiting, a partridge in a pear tree, fatigue, and loss of coordination.
I'm sorry, I couldn't resist.
These and other side effects and recommendations are for monitoring are described in the drug label. Okay, but the important thing of it is that it's a newer medication that's out there to control seizures. There are things that are happening in the wonderful, wacky world of epilepsy that continue to give us hope, that continue to provide more options for people who have epilepsy and aren't getting perfect control over their seizures, or if they are experiencing a lot of side effects.
And I think that that's great. I mean, since I've been on the show, it's just been amazing to see how many different drugs have been approved, and we haven't had the opportunity to really revisit to see how those medications are working with people, but just to have the option. I mean, when you think about it initially, maybe there was just like one or two drugs to choose from. And now having multiple types that would fit, whether it's a person's lifestyle or anything else that comes a part of that, it's amazing. So I really do appreciate all of the people that go in and do this type of just these studies and the research, because they really do help a lot of people out, like myself. So I appreciate that hard work that they do.
You know, and you know, part of the stuff that gets done, and part of the reason that there are these, that we're seeing this forward momentum as far as epilepsy treatment is concerned, is due to the Epilepsy Foundation of America.
That's
Because
awesome.
they, you know, and you know, they don't pay me to give them a plug, okay? I wish they did. But the fact of the matter is that they do fund a lot of research, okay? They also fund research in the sense that they help newly trained physicians get into the field of neurology and also epilepsy.
Nice.
Okay, so what they do is they kind of plant those seeds, you know, by providing them scholarships, okay? And they're not a whole lot of money, but it's enough money that it allows a promising physician, okay, to look at the world of epilepsy and say, hey, you know what? I kind of like this stuff. This is kind of interesting. I think I'll, you know, I think I'll spend my efforts and my time actually working in this particular field.
And you know, that just brings up the whole thing, like when we were talking to Brian on one of our previous shows and thinking about just how he was telling us about his journey from starting in one thing and being involved in that, and then moving on to having more interest in the brain or that neurology piece and all of that. So it's, you know, it's always interesting how you can start somewhere and then your journey leads you to somewhere else. So having that incentive to, maybe you didn't even think about neurology or that part of epilepsy, and to know how many people are affected by it. I mean, it seems like anytime I share with someone that I'm either talking about epilepsy or awareness, I would have to say, there hasn't been one time that someone said, that hasn't said to me, or they have said to me, I should say, I know somebody or someone in my family has epilepsy. Or so it is something that I continue to say anytime we're on the show, that it continues to be a rippling effect that really affects us all. So it's important, you know, to think about how not you're only helping yourself, but the other people that are in your communities and just worldwide. So, you know, way to go, everybody.
Yeah, and so, you know, but the point being, okay, that, you know, there are people out there that are plugging away, trying to improve the life of people who have epilepsy and those around those individuals, okay? And that improves all of our lives, you know. The other thing of it is that Aptiom is out there. If, in fact, you're not satisfied with what's happening as far as your medications are concerned at this particular point in time, maybe they're not controlling your seizures, it's something for you to look into, okay? So you need to ask your doctor about that. Okay?
And you know what? This is another reason that people should watch us, because we talk about so many different drugs. You should be able, like, if you're thinking about these things or you have questions, because we're talking about it, make sure that you talk to your neurologist or your epileptologist about these things to see if there are options for you.
Yeah.
So we're not just out here having fun. We actually have some really good information. So
Every
take
once
that.
in a while.
Yeah, we try to, you know, switch it up a little bit.
You can't, yeah.
Not too much. But the majority of what we talk about is definitely pieces that you can take away and find out more information. And if you need information about having or getting a neurologist or learning more about an epileptologist,
You can call us at 513
721
29
05.
or 1-877 804 2241 through that
Ah, that monkey,
curveball.
yeah. Oh, let's just put the monkey wrench in there.
Or you can contact us at www.hyphen
Epilepsy Ohio. .org.
Okay, good. There's one other thing before we move on to other subjects. There's a medication known as ONFI, ONFI, which has also recently been introduced into the United States market, and I think it's been maybe a couple years. Okay, but there's been an indication that this particular medication It's also known as clobazam. Okay, but there's been some data that's been collected, because what the FDA does, they collect data on medications as people use them. Okay, to get experiences. That's how come they get this list. That, you know, dizziness, tiredness, you know, the side effects of medications. That's how they find them out, because people report them, physicians report them to them. Now, there's been some reports of a syndrome known as Stevens-Johnson syndrome that sometimes shows up with Onfi, with this clobazam. And it's just recently, this has just recently emerged, this information. And what this is this is a very bad rash that a person gets, and it can cause damage not only to the skin, blistering, holes, things such as that, but also it can cause damage to internal organs.
Oh my.
Okay, so this is kind of a deadly type of a reaction that this medication can have.
Oh my.
Now, I don't want to unduly alarm anybody.
Don't be alarmed. There's some stuff out there giving out rashes and blisters, tearing your bodies up. But don't worry about it. It's okay. Yes, it's too late. But yes,
you just had to do that, didn't you?
The sky is falling. The sky is falling.
Gosh, God, I swear.
Bam!
You know.
So don't be alarmed, but take into consideration the knowledge.
No more caffeine for you.
I don't even. Yeah, I did have a Pepsi. Boing, boing, boing.
Okay, but here's the point.
All right, Tom Cruise.
The point is, okay,
Yes,
that usually this particular side effect shows up within a month of the person initiating their treatment for this. Okay? So it doesn't, you know, if you're already on this and you haven't seen it, there's a very, very slim chance that this is going to happen to you.
And then everybody is affected by different medicine, different ways. I think, like you said, some of those main side effects, but you know, different people can have those different reactions. But my question is, with all of these different names, who's coming up with these names? The FDA?
I don't know. No. They pay people money to do this. This is the gig we need to get.
I know. I got some great names for this stuff, but all of these other things.
I'm telling you. Well, you know, we could have our own office. You know, our own little door. They would probably even come and pick us up.
I'm ready for a driver.
And drive us to the office, and we could sit around all day.
And make up different names for drugs. Shimmy, shimmy, time. That's the new one out. Supercalifragilistic.
Order oodles of Starbucks and sit around and.
I'm not a Starbucks fan. I'm sorry. I'm just not though.
Oh, we figure something out.
Okay.
Okay.
More of a potato pancake now, you know.
Izzy's in Starbucks, and we just sit around in there and come up with these names. That would be great. I could.
Yeah, I'd even do overtime.
I could deal with that.
More drugs, please. More names.
But you know, the Onfi thing, I think it's kind of.
Yeah.
It's kind of weird.
That is.
But you know, they do, and maybe on the side we could do cars too.
Cars. You are all over the place right now.
No, we could, you know, names for cars, all kinds of stuff. Naming.
Oh, I didn't know where you were going. I thought we were getting a car dealership on the side to figure out names for drugs. I thought we were just trying to do a
Margo
whole
and
thing.
Tom's naming. Names are us.
Need a name for your drug? Call Margo and Tom. We'll give you
whatever
one.
it is. We don't care what it is. We'll name it.
This is why no one takes us seriously.
Okay. It's your fault.
So, new drugs, let us know. If
Here's another one. Here's another one.
Oh, another drug. Awesome.
We're not done yet, but we're almost there.
We should have another segment just called All About Drugs. You know how they have All About Sports?
Yeah.
We could do All About Drugs because we have about 75 drugs every time we do this.
I know. Well, this is important, I think.
It is. No, not at all
I'm
to
sorry.
say it's not important.
I think you're...
No, I'm not. Don't try that. I'm not at all. I'm just saying how we do news, weather, and sports. We can have all. Let's move on to the next drug.
Throw down.
Let's just go to the next drug.
That's what we ought to name this. Throw down.
Are you frustrated? Are you angry? Throw down.
Okay, here we go. Okay, there's a double-blind, randomized, placebo-controlled trial for diazepam auto-injectors.
Does that have to do with our cars?
Yeah, that's the thing that feeds the gas.
It just got real quiet, like, I didn't know. I was thinking, okay, well, let's find out more about this auto-injector.
No, but see, this is, okay. What they're going to do is they're going to try to use this, okay, in order to stop non-stop seizures, okay? When a seizure lasts a long period of time, usually longer than 5 minutes, though sometimes physicians will prescribe something called Diastat, which is a gel form of Valium that is administered rectally, okay? Now, there are certain problems with rectal administration that we don't need to go any further.
That was my whole side I looked to you about injecting through the through that back door, the barn door.
No. Yeah, right. But so what is happening is they're doing a study with this, but this is an auto-injector that basically what they would do is they inject it into maybe your thigh or maybe your arm or another large muscle group.
Oh, like an EpiPen.
Exactly.
Okay.
So they're doing the studies on this thing, okay, which is really, really promising. So yes, exactly. It's exactly like an EpiPen, except it's to stop non-stop seizure activity.
Well, I don't think I need one of those because I have an EpiPen, and if I had an auto-injector, who knows what I'd be sticking in myself with. Epinephrine, auto-injector,
Yeah.
Hopefully some will be offside.
Okay. But this is something that they're doing, okay, and I think it's great. This is going to be a this is in process, okay, and we're going to see what happens with this. This might be very much a positive type of thing happening again in the world of epilepsy, okay? Another way of treating seizure activity and preventing from people having to go to an emergency room. You know, because at the 5-minute mark, what we say is usually if a person has a convulsive seizure or a tonic-clonic seizure that lasts longer than 5 minutes, they need to go to emergency room. Or if they have one, it stops and then they have another one on its heels. Okay, so if they have a series of them, they're supposed to go to an emergency room. This can prevent that emergency room visit. As you well know, emergency room visits are extremely
Expensive.
Yeah.
And long.
And long.
Drawn out.
Yeah. And then
Great bedside manner.
And then at 4 o'clock in the morning.
Yeah, that's the definite place you want to be, especially when you're in the emergency room with all of the other wonderful characters in there.
At 4 a.m.
Exactly.
On a Friday night or on a Saturday morning.
It's a party up in there. So with this, does this mean with this drug, does it mean that it's gonna just stop the seizure, or does it calm it down?
That's what they're
looking
exploring.
Okay.
And they're looking at the fact that it's going to stop the seizure activity.
That would be
Prevent
awesome.
the person from having to take that trip to the emergency room.
That would be great.
Because a lot of times, you do that 2 or 3 times with a child in a month. Man, you're not making your house payment.
Right, and I have actually known when I was doing a lot of information for like taking people's stories and their story about how they've dealt with epilepsy in their life, And there was a woman, and she said that at one point it was like they went to the emergency room over 50 times just because of so much seizure activity.
Yeah.
And because, you know, and I think that that's the other part that helps with all of these different, well, with all of the different medications and the more work that they go into with the research, because at the time they didn't say that her daughter had epilepsy. They weren't sure what was going on. So, you know, that can be a really stressful situation when you're not for sure why the seizure activity or the seizures are happening. And then you're going all the time and you're still getting that same answer or the result. So
the same song and dance is what it ends up being.
Yeah.
You know, you're not even getting the daggone answer. If you could get an answer, you could kind of
stop going.
maybe move on.
Right.
You know?
And find that other option. So that would be awesome. Even for, you know, just like we talked about with the ORs, if you could just have that thing, and hopefully this will be open to not just those, you know, ongoing seizures, but maybe just overall in the epilepsy family, you know, to be able to put that to an end, at least not to cause it, because it's such a traumatic situation, and it takes so much out of you when you have one, and to be able to just totally dismiss that.
And I think it takes so much out of the entire group, of the entire family, you know, and all your significant others, because, you know, it takes a toll on you physically, okay, but it's also taken a true toll on everybody else emotionally, you know, because they're thinking, oh my gosh, you know, is she going to be okay? Is everything going to turn out all right? You know, so it becomes an incredibly stressful situation for everybody involved.
And especially thinking about young children.
I
mean, I was just looking at some of the numbers as far as their subjects, and between 2, 5, 6, and 11, and greater than 12, that's a lot of, I mean, those ages, and especially between 2 and 5, that's, I can only imagine, especially working with that. I mean, I know that it is stressful for any age, but to see your child go through that at such a young age and not have any idea, or really to be able to grasp it, you have to take on that emotional distress for them. So, you know, that's a rough road.
And I think that's, you know, you bring out an important point. One of the major feelings that people have when one of their loved one has seizure activity is that feeling of helplessness. Because the thing you want to do the most is to make it stop. And the thing you can't do is make it stop.
Right.
So this might provide another option for folks that we can actually begin to make it stop. You know, the diastat works fine for kids, okay? But, you know, there aren't a whole lot of adults who are going to let you do that, you know, or, you know, you get in high school, you know, hey, Mom, guess what? I'm not going to school.
Turn around, dear.
I'm not going to school with this. This ain't going to happen, you know?
Yeah, they need a more adult
type of administration. And this may very well be the answer to that. So let's hope so. And what we promise to do is we will keep our vast viewing audience actually abreast of this, and let you know how this turns out with this auto-injector for diastat.
Definitely.
Okay? And if you want to talk to us, or you want to contact us at the Epilepsy Foundation, you can do that at 1-877...
205. No, that's not it. 807?
1-877-804.
804. Why are you getting upset with me?
No,
No, that's not it.
No, I wasn't getting upset.
We need to just put it up there so that we don't have to guess. How are we going to be advocates and still don't know the number?
I got to admit, I did that kind of deliberately. I
thought we were supposed to be a team.
Or you can call us at 513
721-2905. I know that number.
Or you can contact us electronically in the information age at www.epilepsy-.
Ohio.org.
Ohio.org. Thank you.